Hello students. Welcome to the next session of the pharmacology discussions. And in succession to the previous videos, what I have uploaded on the local anesthetics. So today's topic, I'll be mainly focusing upon the local anesthetics. And there are certain facts in local anesthetics what are being very frequently asked in the various competitive exams in and in students that there are certain questions what are going to be asked in more or less the same way but in a reworded manner. The same concept they are going to ask you in the NEET PG entrance exams or the other competitive exams. That is has been a usual trend that the same concept of is being asked over and over again, rewording the same questions. They are going to ask you the same fact, but by just rewording the same question in the form of MCQs. So today's topic will be mainly focusing upon the local anesthetics and the drug interaction and the adverse effects. And these two topics is the drug interaction of the local anesthetics and the adverse effects of the local anesthetics. I have tried to summarize the concepts in the form of simple MCQs. These MCQs, what I have taken, it is mostly from the old board exams papers. Since in the NEET PG entrance exams, the trend what is being followed is nowadays is because of the trend what is in the board exams. So these are beginning with the topic. So students, beginning with the first question. The first question what I'll be taking up here is the most what is asked. The first question is that is the duration of action of lidocaine would be increased in the presence of. So students, the beginning with, so here in this question they are asking you about the drug interaction of the local anesthetics. So when looking of the drug interaction of the local anesthetics, the options what they have provided you over here, it is that is the first option they are giving you the prazosin, the next is the propranolol, the third is the hydrochlorothiazide, the next is the lisinopril, and the final is the digoxin. So students, the duration of action of the lidocaine would be increased in the presence of which of the following? So students, as in the options, you can see that these are the antihypertensive drugs. So with the help of this question, I am going to clarify your concept about the drug interaction of the local anesthetics with the antihypertensive agents. So in this question, the answer for this particular question, it is the propranolol. Now, beginning with it is the propranolol which is going to prolong the action of the lidocaine. How? The mechanism of action, the interaction of these two drugs can be understood. So students, propranolol is going to interact. The answer for this particular question is propranolol. And since the propranolol is going to interact with the lidocaine in two ways. Firstly, it is going to slow down the heart. So it is going to slow down the heart via the beta receptor blockade mechanisms. Ultimately, what is going to happen is, so when the heart is going to slow down, what is going to happen is the blood delivery to the heart is further reduced, and therefore since the blood delivery from the heart is reduced and the amount of blood what is being pumped by the heart is reduced, so what is going to happen is the blood delivery is going to get slowed down to the liver. Ultimately, the lidocaine is also getting the delivery of the lidocaine to the liver for its metabolism is also slowed down, and this would result in the elevation of the local anesthetic to a longer duration in the systemic circulation, and which can potentially accumulate. So this was one of the mechanisms by which the local anesthetic is going to interact with the propranolol. The next mechanism, the next interaction between lidocaine and propranolol can be looked upon as that is both, either it be the propranolol or the lidocaine. Since lidocaine, it is an amide, students, as I've already told you in the previous video, lidocaine is an amide type of local anesthetics. So its metabolism is going to occur in the liver. So lidocaine and propranolol, they are going to compete for the same enzyme in the liver, and thus the metabolism of lidocaine is further reduced. So in this by the help of this question, student, I have talked about one of the interaction of the local anesthetic with the antihypertensive drug, that is the propranolol. So propranolol is going to have a beta blocker. Propranolol is a beta blocker antihypertensive, and this propranolol is going to block the beta receptors in the heart, and ultimately it is going to slow down the heart. When the heart is slowed down, the pumping action of the heart, delivery of the blood, and the local anesthetic is further slowed down to the liver, and this results in the local anesthetic to remain in the systemic circulation for a longer duration, and thus it can potentially accumulate to toxic levels. So there are two mechanisms. The first drug interaction, second drug interaction of this amide type of local anesthetic I have discussed. Moving on to the next question. The next question, what I'm taking up over here to understand one of the very favorite MCQs, what has been very frequently asked, that is, a patient has been given a large volume of a certain local anesthetic agent, and he's going to develop cyanosis and methemoglobinemia. So students, this is the question. A patient who has been given a large volume of certain local anesthetic agent, and the patient is going to develop cyanosis as well as methemoglobinemia. So the local anesthetic, what is responsible for the causation of such symptoms is the options what they have provided is the procaine, the prilocaine, the lidocaine, and the mepivacaine. So students, do remember, this is just a strict memorizing concept, strict memorizing question where the answer is prilocaine. So the prilocaine, which is mostly manifested in the form of cyanosis and methemoglobinemia. Moving on to the third question. Now students, with the help of this third question, I'm trying to clarify about one of the other facts, one of the other the fact or the drug adverse effect very frequently asked over and over again in the various competitive exams, just by a slight rewording of the same questions. So students, the question here says is the high plasma levels of local anesthetic cause. The first option what they provide you, it is the inhibition of peristalsis. Next, the stimulation of the baroreceptors leading to severe hypotension. Third, that is the inhibition of vagus nerve to the heart. And fourth option what they have provided is the depression of the inhibitory neurons in the central nervous system. So students, the high levels of the local anesthetic, out of these four options, what we need to choose is the most correct option. So here the answer goes to the depression of the inhibitory neurons in the central nervous system. So students, make this point very clear that whenever a local anesthetic is getting elevated to much higher levels or has been injected intra-arterially to a much higher level, the high plasma levels of the local anesthetic agent may cause depression of the inhibitory neurons in the CNS. So students, here the D option is the answer over here. And with the help of this option, I would like to clarify another very important concepts. So students, initially when a local anesthetic is injected, so initially the local anesthetic, if it is going to be administered to a higher level, if its plasma level is going to increase to a higher level, the initial symptoms, the initial adverse effect, what is mostly seen, it is that it is going to inhibit the central inhibitory neurons are going to get inhibited, leading to CNS stimulation. And when the central nervous system is going to get stimulated, that can cause convulsions. So this is the convulsions. Initially, the adverse effect, what is manifested in the patients who are having high plasma levels, that is CNS stimulation, which can lead to convulsions. There can occur in the patient's body, but at the higher doses. So whenever the local anesthetic is in higher dose, The ultimate reaction, what occurs, the adverse effect, what occurs is that the local anesthetic is going to inhibit both the inhibitory as well as the excitatory neurons, and that is ultimately going to lead to the CNS depression is going to occur. And this CNS depression can lead to respiratory depression and death. So students, in the various MCQs, what they most frequently ask is when the adverse effect of the local anesthetic, smaller doses. So if the local anesthetic is being injected in a smaller dose and if it is going to cause any adverse effect, that is the CNS stimulation. In lower doses, the adverse effect, what is mostly seen, it is in the form of CNS stimulation, which can lead to convulsions. So if by accidentally or in some kind of an accidental injecting of a local anesthetic is going to occur, the initial adverse, it is the CNS stimulation. And if the local anesthetic has been injected to a much higher dose, ultimately both the inhibitory as well as the excitatory neurons are going to get inhibited, and that will ultimately lead to the CNS depression, leading to respiratory depression and the death of the patient. So this is the concept what is being very frequently asked in the various MCQs. Moving on to the third question, the same question has been reworded in a different format, and this has been another very favorite questions what has been asked in the various NEET PG and the entrance exams or the competitive exams. So unfortunately, the question says over here, unfortunately, you injected large amount of the local anesthetic intra-arterially. The first sign of lidocaine toxicity, that is the first sign of the local anesthetic toxicity, is going to be the CNS excitation. So students, if the local anesthetic, the large amount of the local anesthetic, if it is injected to a larger dose, larger amount, the first sign what is mostly elicited, the first sign what is mostly seen, it is the CNS excitation. And if it is that the higher doses, the sign what is mostly manifested, it is the CNS depression. So the CNS stimulation is going to be the first sign what is mostly seen at higher doses, and at higher doses, if it is having a longer duration of action, at later stages, it is found that CNS depression can occur. So if any kind of an adverse effect, if you are finding in a patient that the patient is showing convulsions, so it is mostly due to the CNS stimulation, which is the initial symptom, which is the initial adverse effect response what is seen in the patient. And if the local anesthetic what is being given, it is given for, if it is there in the blood plasma for a longer duration, and that too for the blood plasma levels of the local anesthetic, if it is going to be high for much longer duration, so that will ultimately lead to CNS depression, which can result in respiratory depression and death. So students, by the help of these three MCQs, the multiple choice questions, I have tried my level best to clarify the concepts what has been very frequently asked in the various competitive or the PG entrance exams. So students, if you do have any queries or comment, don't forget to comment me in the comment section. If you do like this video, give this video a thumbs up, and thank